Once again, this is Dr. Hatem El-Aishi from Dr. Hatem El-Aishi Medical Center in Cairo, Egypt. Arthritis is not only about pain and painkiller. It's about much more than that. If you drink painkillers for the joint pain in your autoimmune rheumatic disease, in your arthritis, your joint pain will be less. But painkilling is not enough here. You need to control the original source that triggers inflammation in the joints. Just a reminder of how the autoimmune disease started in your body. You can refer to video number 2 of this series for more details. You inherit the button for an autoimmune disease. This button gets switched on for some reason or another. And when it is switched on, your immune system will look to your joints and will not recognize them anymore as part of the body. Maybe a microbe coming from outside. So the immune system will attack the joints. When the joints are attacked, they get inflamed and painful. Now the painkillers act here, on the joint pain only. Painkillers don't act here, don't act on the original source that triggers inflammation in the joints. This video explains why we need to stop or control this inflammation and why painkilling, even if it reduces the pain and makes you happy, yet alone is never enough. I'm talking about acting here. It's not enough to act here. Let me explain what happens when a joint in your body gets inflamed. Over the short term, it's been there for days or few weeks, and over the long term, it's been there for many weeks or months and is not treated. We start with the short term first. If an organ in your body, joint or other, is inflamed, this inflammation will cause 3 types of troublesome symptoms and signs. These are how it looks might be affected, how it feels might be affected, and how it functions might be affected. How it looks, it might change in size, it swells, which can make it painful. It might change in color, maybe it turns red. How it feels might be affected. You might feel pain in the organ, and it hurts when you press on the organ. We call it tenderness. It becomes tender. And how it functions might be affected. What you experience here depends on the function of the organ. If this is in the joint, you get stiffness and inability to use the joint. If it's in the muscles, you get muscle weakness. If it's in the lung, you get shortness of breath when you do little effort, maybe cough. If it's in the colon, you get diarrhea, bloody diarrhea sometimes. If it's in the kidney, you get impairment of the kidney function and maybe your blood pressure goes up. And if it's in the skin, you get loss of integrity of the skin. If it's in the blood vessels, you get poor blood circulation in the organs where the blood flows. As long as there is ongoing inflammation in the organ, pain and the rest of the symptoms will be there. And painkilling, if used, will be no more than a temporary symptomatic solution. And this is one good reason we need to stop this inflammation, to put a radical end to the troublesome symptoms by acting at that point where inflammation starts. But there is another even more important reason why we need to control this inflammation in autoimmune rheumatic diseases. It's the long-term consequences of a persistent inflammation, the long-term issue. Do you know what happens if inflammation is left to persist without treatment? It is not only the continued inconvenience and trouble of the symptoms, the pain for example. It's much more than that. There's a bigger price to pay. This continued inflammation might, over the time, months and years, progress to damage the organ so that the patient may lose its function in an irreversible way. If it was in the joint, he gets deformity and irreversible inability to use it. If it was in the muscles, he gets a wasted muscle that has no more power. If it was the lung, he gets respiratory failure. If it was the kidney, he gets kidney failure, and so on. For that reason, if there's a chronic inflammation of an organ in the body, it is important to control it with the appropriate treatments and not to waste time, so the organ will not go to irreversible damage stages. So we have more than one important reason to control the inflammation in autoimmune rheumatic diseases. Now the next video is about the goals of treatment in a patient with an autoimmune rheumatic disease. It's a preparation for discussing the types of medications that we use to treat autoimmune rheumatic diseases immediately after that.